Hi, Dr. Dan Mossell here. Dan Mossell, Mossell Holistic. Welcome. Welcome to our talk on kids' health. You know, kids' health is, as I thought about this for the past several weeks, getting ready for this, it really struck me that it's not so much for, as important as it is for the children to be healthy now, of course. But if we do things right and we create good habits now while they're young, when they become adults and they start hopefully having children, that we've taught them well, that they will in turn raise healthy children. And as we know, there's it's getting harder and harder to raise healthy children. Our societies seems to be conspiring against us, doesn't it? So it's up to us to create a community and hang out with like-minded people and educate ourselves. I mean, I'm still learning every day. I hope you guys are too. So yeah, so it's if we do things right, we give them a good, healthy start for their whole life, and then as they hit middle age, elderly days, they're they have a lifetime of happy, healthy habits. So with that being said, this is subjects near and dear to me now. I have four granddaughters, and I see my three children. I just remember when they used to get so upset. I mean, not that we ate perfect by any means, believe me, but we ate pretty good, and wouldn't allow certain things. And and they used to get, Dad, how come you have to be a doctor? You know, we can't do a lot of things our friends can do. I said, I predict. Used to drive them crazy. I said, I predict someday you'll be glad I did this. And now they do tell me that definitely I was spot on, as usual. So anyhow, I'm going to share my screen here, and we'll get on with the presentation. And so we're going to keep it hopefully nice and concise. Let me just present, and there we go. So yeah, kids' health success leaves clues. So and I believe that to be true. I think we, we see things, and then so the question is, do you think we live in a healthy or a sick country? I think most of us would agree that we're not as healthy, nearly as healthy as we could be. I've seen a couple different places where they're saying children being born now for the first time in a long time, their life expectancy is less than the generation before them. So that doesn't bode well for us as a country. Um, I mean, it's just the expense of taking care of sick people. I mean, monetarily as well as just the time and effort, and it's just it's most of it's avoidable, usually. So I like this picture. We've got sick care versus health care. Which will you choose? Yeah, you look at the average, supposedly the average medicine cabinet. That's supposedly kind of what it's like. And, I mean, some of those things are good to have, I guess, but a lot of times it's people live on these things as opposed to the right, where getting your nice greens and eating the rainbow, as they say. So health is actually the body's ability to adapt to stress. And there's different kinds of stresses, right? I mean, there's the forever in chiropractic, we've talked about the triangle of health. And here up at the top, it's depicted a different way, but it's still the same thing where you got trauma, toxins, and thoughts. So that's your physical, chemical, emotional. Um, in the physical, the trauma is the actual being born, the birthing process, walking, prolonged sitting, sitting at a computer all day, a couple of different things there. Playing sports, of course, falls, trips, accidents, our posture. A lot of you have seen your posture app where your head is forward an inch, 2 inches, some 3 inches. I had somebody the other day, their head weighed functionally over 80 pounds. It's crazy. And then just gravity pulling on us 24 hours a day. And regular activity. And it's funny because in trauma here, we got regular activity and then you got lack of regular activity. So, activity is good though. Just doing it right is the proper thing. And then you got your toxins, and it's your nutrition, processed refined foods, fast food, all these food additives. A lot of these food dyes they're finding out are just cancer causing and very excitatory. Anybody with ADD, ADHD, you got to look at that. Poor nutrient intake, dehydration, uh, prescription drugs, over the counter. Hopefully, kids aren't using too much, but us adults, having children, we're doing using tobacco, alcohol, caffeine. A little bit of caffeine is okay. I have no worries, no problems with that. But then a big part I think is often overlooked, and we'll be talking a little bit about this towards the end of the talk, is our thoughts, our mental, emotional stresses, finance, time, not having enough time, school, family, loss of loved ones and friends, and job and financial worries. So I like this chart down at the bottom here. We talk about, illness. And we've got on the right-hand side is wellness, optimal health, 100% function, active participation, living a wellness lifestyle. But then over to the left is illness, where you see it's disease, multiple meds, poor quality of life, body has limited function. How many people, we see somebody in their 80s, early 80s, late 70s, early 80s, and they're pretty active and they're moving around and they're kind of the way they should be. And people go, my God, is he sharp or she's sharp? Still, look at her, the way she moves. Well, that's the normal. We we've got things backwards. So then most of us are somewhere in the middle in that comfort zone. And I always tell people with this chart, it doesn't matter so much. It's what's more important as opposed to where you are. It's which way are you going? Are you moving towards illness? Are you moving towards wellness? So, and that's a fixable, doable, changeable thing. So let's set the kids up right, and hopefully, as they age and we age, will be blessings and not burdens to them. So we're going to talk tonight about the signs and symptoms, the big common thing for children, ear infections, colds, headaches, asthma is on the rise now with all these fires going and this global climate change. Asthma's skyrocketing. Hyperactivity is a big thing. Developmental delays, colic, fever, flus, poor sleep, constipation, and allergies. So we're going to go over these one by one. So once again, this is the three variables we talked about: the physical, emotional, the chemical. So and they're all, as you see, it's an equilateral. Usually a triangle, but here it's all equal weight. In my mind, and so physical stressors. Your average 2-year-old falls 38 times per day. I believe it. I've had the good fortune to have now 3 grandchildren live with me over the past several years. Have a soon-to-be 2-year-old, and she's definitely fallen her 38 times per day. Some just little tiny bumps, and others are pretty darn good. So we know um, kids take a beat. That's why I always say, they fall so much. They're built low to the ground, not too far to fall. So so chiropractic and health is, well, chiropractic is the beauty of it is we know our body is self-healing and self-regulating. Sometimes it just needs a little help. And with all these falls and these toxins and even, as most of you know, I do a good bit of emotional clearing. So we can address all sides of that triangle. And so we know that we live our life through our nervous system. Our environment leads to our physiology. So, and that includes, once again, all three sides of that triangle. Chiropractic's, I think, the ideally suited modality for just wellness and health. Thank God I'm a chiropractor. I say that every day. So feeling versus function. A lot of times people feel okay, but they're not necessarily functioning good. You know, it's as you see, this is the nerve. You got your motor nerves, and you got your autonomic nerves, and the sensory nerves is a small part. That's so that's a lot of times people feel good, but they're very unhealthy. So yeah, that's the central nervous system. Here's the spine, and that upper cervical C1, C2 has a lot to do with the immune system, our head and neck, eyes, and all that. The lower spine has that's part in tab and excuse me, that's tied in with the thyroid, our teeth, tonsils, ear, nose. But then the thoracic, mid back, all that. We're going to go over these in a bit. You'll see how this ties in. So first thing, ear infections. So that's a lot of times tied in with when we talk in chiropractic about subluxations. Subluxations are when there's a lot of definitions. I've seen countless definitions of the subluxation, but all it is more or less just that our spinal cord comes through the spine, and it exits, and it has all these C1, 2, 3, 4, 5, 6, 7. So we know that for ear infections, a lot of times children have one of their cervical vertebrae are out, however you want to say it. A subluxation is just that it's not optimal function of that nerve for whatever reason. And there's, like I said, there can be a multitude of reasons. And but we know teething can cause ear infections. You get a lot of when our little Emily, the 22, 21-month old, she just broke a big molar through the other night, and she had all kinds of snot and some trauma in her face, just a lot of inflammation in the whole area there. No ear and stuff, but thankfully. But we know birth trauma can cause it. Birth trauma is in a lot of these. The whole birthing process. That's why getting children adjusted soon after they get born. And we adjust babies so differently, of course, than we adjust grown-ups. Very, very subtle, very nice, easy adjustment. They love it, actually. Parents don't like watching it, but the kids love it. Dairy is a big contributor to ears. I myself, as a youngster, I loved cheese, and I ate cheese every day, a lot of it. And sure enough, I had earaches and ear infections, all sorts of antibiotics. Finally, they did the surgery where they removed my adenoids, the tonsils, and put tubes in my ears. Worked, but I still had issues afterwards. But it was I later on I figured out I realized as an adult I know for a fact it was dairy because if I eat, I can get away with a little dairy, a little too much. I get all stuffy. Um, laying a baby down with a bottle, not recommended. Don't do it. They don't need it. Food allergies is a big one. Once again, dairy may or may not be an allergy, but it's just that it's very mucousy forming, right? But it could be an allergy as well. Could be gluten, could be wheat, and then of course being exposed to the secondhand smoke. I mean, thankfully people way more aware of that now than they were when I was a kid. Back when I was a kid. All right, fevers, flu, and colds. And then once again, that's the that can be subluxations throughout the whole vertebrae, throughout up in the spine, mid back, as well as lumbar spine. Once again, birth trauma. There it is, a weakened immune system, and that comes from a biggie is right below it. Too much sugar in the diet. Um, I I I I go to a friend's party every Halloween, the annual Candy Death March. Um, but it's amazing. By the end of the night, you see all these kids. You see the ones who are just going crazy on their candy. They by the end of the night, they got big circles under their eyes. They're a bunch of snot running out of their nose, it's just you see it, and it's just like wow, there it is. So look for it come this Halloween. Well, it's gonna be a different Halloween once again, but there'll be others, and but you'll see it in your kids. Lack of sleep. um, I see this. I just kids who stay up too late and have trouble with sleep, and um, and I think a big thing too is with colds, flus, and fevers. So kids get sick more often during the winter season, right? That's because we're inside much more, and the air gets. It's. I think the house is for way too cold, way too warm, rather. Excuse me. I like to keep my house. Don't tell anybody in the house here, but it's 66 during the day, and actually 57 at night. And a nice cool house, get underneath those blankets. Even if you got little babies or little children, they're wrapped up. Kids don't feel the cold like we do. They just won't. So don't worry. I'm always trying to tell my son, he wants to put these heaters in these rooms for the little ones. I tell him, don't do it. They don't need it. He didn't have it as a kid, and they're in the exact same room he was in. So yeah, it does not. It's overrated. And then just the eating the vegetables, eating a little bit of fruit, but a lot of vegetables, and easy on the breads and the pastas and the rices, and get kids. If you start treating, if you give them good hearty bread early on in life, they won't need the crappy bread. They won't want it. They won't like it. So, but you got to do it young. And then even cereals, there's better choices. Don't be giving the sugary cereals. And there's some good cereals that have like some amaranth and some nice grains in there that just a little better, little better. Do what you can, but start young. ADD, ADHD. Once again, a lot of times that's upper cervical issues with these children that can come from birth trauma. Diet for sure, like I mentioned earlier, the those food dyes and gluten. A lot of these kids have some kind of allergy, whether it be gluten or be dairy. Corn is a biggie. A lot of kids who have neurological disorders, they have corn issues, and corn is in everything. So that's why you want to eat food as close to as natural as possible. Corn is a biggie. especially high fructose corn syrup. That's a scourge on our society. It should be banned. It should be outlawed. That stuff is, it literally fits the definition of a poison. Um, and so that goes in diet and lifestyle. Once again, that's um, I see a lot of children who have who are considered ADD, ADHD. No doubt, uh, there's things you can do behaviorally, teaching children how to breathe proper, teaching them how to be quiet and how to breathe, and just spending time. Just I like that. I use my 5 minute energizer. You can use this on a 2-year-old. All you have to do is you sit them down, and then you're nice and quiet. You say, "All right, let's pretend," and you can just. I like where just using your hands, pretend. And kids use their wonderful imaginations, of course, right? So just imagine, just pretend that you're drawing some sun, into your belly, and just bring your belly up, and just use your hands on your belly and go ooh, and open up your hands, and just or put a dowel onto the belly and say, okay, breathe down into the dowel, and just teach them to breathe, and you'll be surprised, just and have them imitate you. Work with it. You do that with children when they're all upset and acting out, and teach them how to calm themselves in a healthy way without using a screen. Um, so things that can bring on ADD, ADHD is being born with a low birth weight, difficult births, being born premature. Not much we can do about that, uh, but but we can fix them afterwards, help them. And to me, I think a big part with ADD, ADHD is the lack of being out in nature. Um, get outside. I don't care how cold it is. Dress appropriately. If it's, I'd rather kids, like I said earlier, kids don't feel the cold so much. Dress them appropriately for the weather. If it's raining, get them out. Put them in a raincoat. If it's thunder and lightning, keep them in, of course. But how many? We got to get these kids out in nature. You get out in nature, because if you can't just say, all right, go out, and you got to do it yourself. So, and I think when we get out in nature, I don't think that we become better parents. And we got to model these things for our children. We got to eat right. We got to breathe right. We have to be out in nature. All right. So colic, I've treated colic with pretty good results over the years. I like to use homeopathic remedies, work real well. Definitely kids need to be adjusted, um, both cervical as well as working the checking their stomach and the small intestine and the bowel, fixing the ileocecal valve. Um, that can be part sign of a weak immune system. Mom's diet for sure can affect that. So if she's nursing, and kids with formula, sometimes if you need to supplement with formula, you might have to experiment, find the right supplement, right formula rather. Excuse me one sec. Let me check something. All righty. So, asthma. Asthma, like I mentioned earlier, is really climbing, and it's the air quality in a lot of places. It's getting worse and worse. So that's also uh, that's more that upper thoracic area that innervates those lungs. Excuse me. And once again, the birth trauma, there it is. Uh, there's a 20% increase risk with the cesarean birth. the cesarean, it's that whole being born, going through the birth canal that starts our children off on the right foot with all the microbiome on their body, and in the nose, in the mouth, in our gut, just going through the birth canal, kind of primes the pump for that. So it's uh, so many. It's just cesarean births. A lot of studies are showing just way overused. Um, we know for sure asthma, big time. Dairy. It's very mucousy forming, right? So you can use once it. Do children really need milk? Not really. They need mothers, sure, but not cow's milk. It's totally ridiculous. Not necessary. I like dairy, but I use it sparingly. Um, nut milks are a nice option. You know, the soy, and I don't like soy either. Almond, thank you. That's one I'm thinking of. I do like the almond milk. We've used that throughout the years for my kids. The unsweetened almond milk. People say, "Oh, where are they going to get their calcium?" Well, the unsweetened uh, almond milk has they supplement calcium in that, but too green leafies, great source. And dairy, the highest dairy consuming countries have the highest osteoporosis rates. Dairy has a lot of calcium, no doubt, but it's not a very absorbable form of it. So really not a good source. Once again, exposure to smoke, and it's just dirty air. So allergies, those once again, it can be subluxations, birth trauma. There it is again. What we just went over that. Excuse me. Hold on. Yeah, these are pretty much the same slide. I confusing myself. And a biggie here, I think, is just a weak immune system due to refined foods. I find allergies a lot in children who like sugars, who like a lot of the refined carbohydrates. They're the ones who love their carbs. Once again, increased cesarean birth. Once again, the microbiome. But kids who eat, and adults who eat, people who eat too much refined carbs, they definitely just have issues with immune system. No ifs, ands, or buts. And they're people who tell me, people who have really bad allergies, like the seasonal spring and fall. Um, I get them to clean up their diet. You may not take it away 100%, but it's super duper, way more manageable. And a lot of times people are pretty much done. So we know it's a lot to do with refined sugars and carbs, and you just have to keep it to a bare bone minimum. There's no ifs, ands, or buts. Constipation, digestion issues. A lot of kids have trouble going to the bathroom. It's a very common thing. Once again, these subluxations, kind of the lower part of the spine, especially right in the lumbar spine. That can be from the falls, lack of movement, a lot of just playing too many darn video games, sitting too much. I feel for these kids now who are we're home with the school in front of the computer, you know. So they're sitting more than they would. I was with my 2-year-old today, or 2-month, or second grader. That's it, second grader, 7-year-old. She was, in front of the computer for a good part of the day. That's what they're doing, right? So we know diet and lifestyle. Once again, eating too many refined carbohydrates, refined foods, not enough greens, not enough fiber. So you gotta, and using lousy, even when they do eat bread, eating white bread, very little fiber there. But greens, once again, a lot of greens. Dehydration's a big thing. Keep. My wife was the expert at this. She said, just always offer them food, offer them cut vegetables, offer them cut fruits. Just if the kids are sitting around, just just don't ask them if they want something. Just cut it up, put in front of them. They'll eat it. So yeah, you just got to do it. Offer them water. Don't no fruit juices. Never ever. People say, "Oh, I water it down." It's still garbage. It's still just sugar. Don't do it. If you wanted to, if you have some fresh oranges or grapefruits, you want to juice them, by all means, go ahead. But I, you know, I want to do yeah, just don't do the apple juices and store-bought orange juice. It's garbage. Leaky and damaged gut. A lot of kids already. What they're finding is if you got to have GMO. If you're going to eat wheat, it's got to be GMO free. Don't get the GMO because and it has to um, because they will spray. Um, Wheat's not a GMO product, but they can still spray at the end. They'll put the Roundup on it to help dry it out, so they can harvest it faster and bring it to market faster. So it's just terrible. If do it for the last 2 weeks before they harvest it. So don't you gotta buy certain things. You just have to buy. Spend the money. And GM organic wheat is for sure one of them. Please. But then too, for this whole constipation, we can treat that. That's so fixable, and a lot of times there's big time emotional issues with that. We work on that. Kids get better. It's very rare that you need to supplement with children. We can fix this. Kids, the beauty of working with children is they have such vitality, amazing vitality, that they respond a lot better than somebody who's 40, 50, 60. It's amazing. The kids are absolutely a dream to work with. They're the biggest challenge with children is getting them to eat good, but you got to do it from day one. Just do it. You know, sleep issues. Yeah, sleep issues are a big issue. Once again, there's birth trauma. I didn't put these slides together. Looking at it now, I didn't even realize it was there on all of them. I guess I saw it, but anyhow, so let's just assume there was some birth trauma. But we clear it and then it's done. But eating before bed, especially sugar is going to keep these kids buzzed. And it's just it's it it, it the sleep won't be nearly as good. Um, uh, Issues with lifestyle balance. That's just you have to set patterns for the children. Most people are pretty good about this. I know a lot of moms, especially, really are working with making sure their kids getting to bed at a certain time and all that. I just realized that got cut off. And playing video games before bedtime. And I was just hearing I was listening to a podcast yesterday, and what they're finding, it's not just so much the blue light that they're finding before with the video games that was having issues, but video games are just so stimulating. They stimulate us way more than a book does. Just that's the nature of those games, of screens in general. So it's just way more engaging, way more stimulating. So yeah, so no video games. Pull out the books. You bring out a book, and I do it with my grandkids all the time. I say, you want to read? No, no. I said, all right, well, I'm just going to sit here and read. So I'll just pull out one of their favorite books and I start reading. Next thing you know, whoop, right next to you. it's something about a book. Kids just they love them. So and studies show that it's just the benefits are just absolutely immense. It's just that's a no-brainer. You got to do it. Um, and here we go again with the nature deficit. I find I've been reading a lot of articles in regards to this for the past 3 years about how what they're finding is for little ones at being in nature, getting their hands and their boots and shoes wet and muddy, it actually can help them build confidence and teach them to make independent decisions. That's awesome. That's huge. Teaching them how to. I was out today, out in the garden, and I went out in the back. I have a compost pile. My granddaughters, I bring them out there. We look for worms, and I give them worms in their hands, and they're full of dirt, and they love it. So, you want to go wash your hands maybe afterwards, but you don't need antibacterial soap. I guarantee you that. That's been outlawed. They're slowly phasing those out. I think there's very few left on the market because you don't need that. You don't want it. So get out in nature. And a lot of people say, well, I don't have nature, but most of us where we live, we do. We can, even if you have just a balcony, get out on the balcony, feel the sun, feel the wind, feel the cold, feel it. And then, look at the clouds, look at the trees. When you're walking, you can see you see weeds growing out of these cracks. I mean, to me, it's fascinating. I mean, the power of Mother Earth, and we're part of that. That's where we came from. So we absolutely need to be out in nature. That's our number one, I think, thing. It was today, my three granddaughters. Around lunchtime today, I'm starting a new garden in the front of my house. And so they were just playing, I gave them the tools. They were playing like that for 25, 30 minutes and just getting their hands dirty, and using their imagination. They made a little fairy garden. It was just awesome. So get out, whatever land you had. The average child laughs 300 times per day. The average adult only 17 times. I ask you, which do you think is better? Number one, it's a lot more fun to be laughing a lot, but we know just health-wise. So we need to learn from kids. We need to get back to our nature. So I that's one thing I was really kind of came to my thinking, getting ready for this talk, is that we're teaching our kids all the time, but man, if we're ready, they'll be teaching us. So watch what they do. See how they self-soothe and do the same. See how they daydream, do the same. See how they make a game of everything, do the same. Let's just get back to who and what we are. And we're really just kids at heart, right? I mean, as I get older, I see that more and more. I mean, that's why I love having the grandkids around. What a gift. So this is, this whole thing is what it is. This just shows your autonomic nervous system. And when you're when you're subluxated, they do studies before and after. And so the green area, of course, is the wellness state. And the further away from that, the more out of whack you are, so to speak, to use a technical term. So we did a lot of studies showing that chiropractic, fixing the subluxations can really help, especially immune system. Study after study has just shown that getting adjusted really can boost your immune system. So it always cracks me up when people cancel their appointment because they said they're feeling sick. And I'm like, well, this is the day you need to be here more than ever. So if that ever is you, don't do yourself a favor. Come on in. or even if you don't have an appointment, call up, get in. You know, we will clean up after you. Don't worry. You know, you're not going to get anybody sick. We'll get you in the room. Thanks. And then here we are back to this. You know, so you know, we want to we know what to do to go from illness to wellness. Takes some work, but you know, I always tell people these things. A lot of these things are simple, not necessarily always easy, but they are simple. And it gets easier and easier with time. It gets easier to eat good, healthy foods. After a while, you know what aisles to stay away from and which aisles you're going to go to, and you know how to fix these good, healthy diets. And people think, oh, healthy eating. I'm always amazed at people who are detox, and I haven't eaten real food. And they say, you know, I thought the food was just going to be awful, but it was so good. I'm like, well, yes, of course, it's just real food. You know, I mean, but anyhow, we just get away from our nature of who we are and what we are. And so let's bring it back, you know. Um, we're really working at our office on trying to get more programs together, I've got a few things coming down the pipe in regards to more of the mental, emotional, and our thoughts, and using biofeedback. So I'm going to be introducing that in the next week or two. So stay tuned for that. Once again, I appreciate you being here. Um, Dr. Dan Mossell here, Mossell Holistic. You know, we're really excited with what's going on. We're going to be expanding our office here. We're looking to go to get a much bigger functional training center coming up. So stay tuned. I am here for you if you have any questions, any issues at all on on anything we talked about today. By all means, please give me a call. We'll talk. You can email me. I really look forward to being here, and talk to you soon. Thanks.